Case control studies are another analytic study that is used in health research. In terms of case control studies, these are very different. They are at the individual level. And these studies, we define subjects for study on the basis of the presence or the absence of a disease or an outcome of interest. When we talk about cases, we're talking about the individuals who actually have that disease or whatever the outcome that we're studying is, whereas controls are the people who do not have that particular disease or outcome of interest. So this is a visual diagram from your textbook, and it kind of visually shows the idea of a case control study. But essentially what you're doing is you're going and you're selecting cases, so people with the disease, and you're trying to find a similar group of people without the disease or controls. So for example, maybe I'm interested in some form of cancer. I'm interested in looking at risk factors for leukemia. What I might do is I might go out and find people with leukemia and then find a comparable group of controls, and you're then going to compare those two groups in terms of their history, their past exposures. So when I recruit these two groups of people, when I recruit cases, when I recruit the controls, their exposure status is unknown. I'm trying to find people with the disease and people without the disease who are comparable. And then I'm looking back at their exposure status to see who did and did not have the exposure. So we're trying to see, did a past exposure differ between these two groups of people, those with the disease and those without the disease? Case control studies are, they're common, and we have used these in understanding COVID-19. This is a great example of a study that used a case control study design to basically try and answer the question, is dining during the pandemic, is this a dangerous activity? There was a lot of debate early on in the pandemic around the safety of going out to eat in a restaurant and contracting COVID-19. So what this study did is it essentially recruited individuals who were COVID positive and compared them with a similar group of people that didn't have COVID-19. They recruited these people from outpatient healthcare facilities. And then they asked both groups of people about their prior restaurant dining behaviors. They found an odds ratio of 2.4, meaning that COVID positive individuals were twice as likely to have reported dining at a restaurant than those who did not test positive for COVID-19, providing some evidence that it's possible that going out to eat during the pandemic, especially those early days, was probably a little risky in terms of being an exposure that could result in a COVID-19 infection. Case control studies have their advantages and their disadvantages. They are really great for studying rare diseases, especially considering other analytic study designs that we have. So for example, a cohort study, you recruit a group of people and you follow them over time. Well, if you have a really rare condition, you may never get a single case of that disease that appears in your cohort. Or it may take a really long time to get even one case appear in your cohort. So things like cohort studies are probably not going to be feasible for really low prevalence rare conditions. When you have something that is rare, you're definitely going to want to use a case control study design. It's going to be the most feasible option. It's relatively quick and easy to complete. You just have to go out and identify cases and controls and then collect data. They tend to be pretty inexpensive, and they usually involve a smaller number of subjects for those studies. In terms of disadvantages, there are a number. The measurement of the exposure might be inaccurate. Cases and controls might have different recollections of exposures, leading to a unique source of bias. The representativeness of the cases and controls might be unknown. It might not be clear whether those cases and controls truly represent the larger population that you're trying to study. You also can't use a relative risk. You have to use kind of this indirect estimate of risk, the odds ratio. So it's not as easy to really estimate the risk. And the temporal relationship between the exposure and outcome, it can't always be ascertained. You are asking people to self-report something in the past, but it's you're obtaining information on the exposure after the outcome has already been determined, and so it can be hard to establish whether there really is a true temporal relationship, meaning that the exposure really happened before the outcome.